So students, let's look into this question. A new method of measuring hemoglobin levels has been developed. So they have given successive readings of a single sample. So you have a series of readings for a single sample, that is the hemoglobin levels. And also they have mentioned the hemoglobin measured by standard method was 10.2. So you have a series of readings which are total 10 readings. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 readings have been given. And also it has been compared that in a standard, compared to this new method, in a standard method, this 10.2 is the reading. So what they wanted to know, the choices is the given method, which is this new method, does it have low validity, low reliability? Does it have low validity, high reliability? Does it have high validity, low reliability? Or choice D, does it have high validity, high reliability? So students, for this, first we will see what is reliability and validity in brief. That is, reliability is also called as precision. Precision, that is repeatability or reproducibility. Whereas validity is accuracy, that is, which is close to the actual value, close to the actual value or the true value. So when you are close to the actual value or being accurate, it is validity. And precision or reliability is when there is consistency in the values. So in the given question, in our question, if we take the mean 9.4 plus 10.4 plus 9.6 plus 9.1 plus 10.8 plus 12.1 plus 10.1 plus 9.8 plus 9.2 plus 9.5, which are these successive readings, divided by 10. So we take a mean of this 10 successive readings. The mean value is 10. The mean value is 10. So now we will observe the value that was got by the standard calorimetry is 10.2 and the mean of these values is 10. So 10.2 and 10, they are almost very accurate. So that means validity is high. But if you look into each of these readings, most of the readings are not close to the mean value obtained. That means reliability is low. Reliability is low. So the answer is B. So the answer is C, sorry. So the answer is C, high validity and low reliability. Because the mean was 10, so there is a high validity because it's similar to the one result that was got by the standard calorimetry, but low reliability. Low reliability because when we look into each of these values, most of the values differ from the mean. So the reproducibility or the consistency is less. So the answer is high validity and low reliability.